I have a concern because nobody has yet measured the amount of fluoride that the bone cells are exposed to when they're turning bone over. If kids have higher fluoride levels in their bone, and their bone cells are exposed to those higher fluoride levels, we know from in vitro studies, studies in test tubes and in culture, that fluoride at higher concentrations are cytotoxic, that they cause damage, they can cause cancer, they can cause, these higher levels can cause all kinds of damage to the cell. So these bone cells are being exposed to, likely, higher levels than normal. And nobody has yet measured right locally, right next to the cell, how much fluoride these cells are being exposed to.
Tell us about your study where you looked at the levels of fluoride in the bones of Montreal people and the bones of people in Toronto. Explain where this study came from and what you found.
I got interested in the fluoride accumulation in bone, and that's one of the reasons I was concerned about water fluoridation. When I discovered that you didn't need to swallow fluoride to make it work to prevent dental decay, I was concerned that people were accumulating fluoride in bone, in kids and elderly patients. At the time that all of these epidemiological studies were being published, where there's an increased risk for hip fractures. Danielson studies, Jacobs studies, these were studies that were starting to raise some concern in the medical community that perhaps fluoride could be causing some harm, some increased risk for bone fracture. So we set out to actually prove that 1 part per million wasn't really that detrimental, that it wasn't affecting the bones the way that some of these studies were suggesting. And that's how we actually got funded. We set out to prove that it was safe. Whether or not that's why we got funded, I mean, that's irrelevant. But the way we designed the experiment was simply to collect hip bones from people that were donating their hips during total hip implant surgery, compare the bone samples that we retrieved from people in Montreal, where Montreal is not fluoridated, never has been fluoridated, compare that to the Torontonians, Mount Sinai Hospital. We now have compared about 60 samples. It turns out that the Montreal bone samples have a very small variation in terms of their fluoride content and hover around 200 parts per million. The variation in the Torontonian hip samples is tremendous. It varies from 200 up to 2,500 parts per million. We're now looking at just looking at one disease entity, osteoarthritis, factoring in all of the age effects, etc., and not even looking at Toronto versus Montreal, just simply looking at the fluoride content. Now we have done that. What we have done now is to look at the fluoride content in the same type of bone, and we've discovered actually, or Debbie, who is the PhD student, Debbie Chashra, has discovered that there's a direct correlation between the fluoride content and the architecture of the bone. In other words, fluoride just from water fluoridation exposure, because we presume that the Montrealers and Torontonians have had the same amount of toothpaste exposure. Because in Canada, fluoridated toothpaste was introduced in the same time. We now believe that the little bit of fluoride that's been incorporated into their bone has affected their architecture. Now, whether that's positive or negative, we haven't got enough data yet to show. And the abstracts that we've published so far at the international meetings basically report these findings, that there are differences between Toronto and Montreal, that we are seeing effect of fluoridated water on the architecture of the bone. Whether or not this makes the bone slightly stronger or slightly weaker, we don't know yet. We do know from animal studies that the strength of the bone actually starts to decline the more fluoride you have in the bone. The fluoride makes the bone more brittle because the crystals are packed tighter, and these crystals actually make the bone light.
Oh, thank you, Dr. Hardy Limeback, President of the Canadian Dental Association at the time of that interview. Boy, did he sock it to those pro-fluoride people or what? I mean, when you get it from the President of the Canadian Dental Association, and the American Dental Association's own journal here says fluoride is a key agent in battling caries, works primarily as a topical treatment, people. A topical treatment on the surface of the enamel, not by ingesting it. So, that dog just won't hunt anymore. Stop lying and saying fluoridation is good for people. It's not. It's not good for the poor children. It actually harms poor children twice as fast as the average child because they have a worse diet. Now, I want to get on. I'm sorry we won't finish Dr. Limeback today, but I will bring it back next week. So those of you that are really interested in the fluoride issue and you really don't want your grandchildren being dumbed down and getting brain damage and you don't want to get osteoporosis as you get older, tune in and hear the rest of Dr. Limeback next week here Monday, Wednesday,